You ever feel like you want to make a change but have a hard time finding the motivation to carry it out? Or you feel as though you're putting that behavioral change off? Or that you're feeling some ambivalence about making that behavioral change? That's where this useful clinical skill, motivational interviewing, comes into play. So just take a second to think about any behavior or any behaviors that you're interested in changing. It could be anything. It could be, I want to exercise more. I want to eat healthier. I want to be more present in the moment. I want to reach out to my friends more. I want to read more. I want to stop spending money on clothes that I don't really need. Whatever it is, that specific behavior that you want to change. Like when you've thought about making that behavioral change, have you found yourself struggling with this thing called ambivalence, where you want to make that change, but you're struggling with actually carrying it out? That's where motivational interviewing comes into play, because it focuses on that ambivalence that surrounds that behavioral change. Because you may have that internal contradiction, such that I want to change, but here are these reasons why I'm not making that change just yet, or these reasons why I don't plan to make that change in the near future. But one day I will, though. One day I will make that change. But right now I'm struggling with this ambivalence. And so motivational interviewing focuses on your internal motivations to actually change that behavior. Because let's be honest, change is difficult. Change is not typically something that's easy to most people. With motivational interviewing, the therapist isn't telling you what to do. The therapist is guiding you so that you tap into your own internal resources, your own internal strengths, and your own internal motivation to actually engage in that behavioral change. And so therapists may applaud your prior successes of changing previous behaviors or taking steps towards changing some previous behaviors. They may find your deep-seated beliefs about this behavioral change. They may ask a series of questions to help you find your own internal motivation to actually change that behavior, while also boosting your self-confidence in the process. And some skills that a therapist using motivational interviewing may use are open-ended questions. And so open-ended questions just allows for more discussion around answering a specific question instead of just yes, no. And this as opposed to a closed-ended question. Yes, those yes, no questions that are closed-ended. And so an example of a closed-ended question is, have you ever made a behavioral change? That's yes, no. Whereas an open-ended question, which is more commonly used in motivational interviewing, an open-ended question would be, please describe the last time that you had a behavioral change. Please describe the last time that you engaged in some sort of behavioral change. The therapist may also provide affirmations, so identifying and highlighting your strengths and resources and your resilience and efforts and successes. They may also use reflective listening, which is a useful clinical skill that shows that the clinician is paying close attention, and then also allows you yourself to hear back what you're saying for a deeper understanding. They may also use summaries, so connecting different aspects of what you said throughout the clinical session to kind of create overall summaries of what you described. So overall, that's just a brief introduction into motivational interviewing, or MI. I hope that someone out there finds this video useful, and I thank you so much for watching.